Hello, everyone. My name is Dr. Yonit Arthur, and you are on The Steady Coach. Today, I am so excited to bring you this interview with Jim Prussack, PT. Jim is also known as the Pain PT here on YouTube, so some of you may already be familiar with his work. Jim is a physical therapist and a manual therapist, and nowadays takes a completely mind body approach to helping people with chronic symptoms, including chronic pain, chronic fatigue syndrome, and yes, chronic dizziness. By mind body approach, what I mean is that Jim uses many of the same techniques that we talk about here on this channel, helping people reduce fear of their symptoms and address underlying emotional causes that are contributing to their symptoms. Jim has a really cool and unique perspective here as someone who arrived at these conclusions after working in a very biomedically oriented field for a while. And he asks some really thought provoking questions that I think you'll be able to use to explore some of the things that are underlying where you are today with your symptoms. So please enjoy this interview. And if you have questions or comments, please, of course, drop them below. All right. Hello, Jim. Thank you so much for agreeing to do this. And I was hoping we could start by you just telling us a little more about yourself.
Okay. Yeah. Well, my name is Jim, like you said,
Mhm.
Jim Prussack, and
Mhm.
I am a physical therapist. I've been a physical therapist for 20 something years now. I can't even remember, 24 years. It's been a long time.
Mhm.
And I live in San Diego, California,
Mhm.
and I have been moving myself from this whole mechanical, structural, physical world from 20 plus years into what we're talking about today, right? Into this mind body world, brain,
Mhm.
nervous system, understanding chronic ailments and illness in the body. And so, yeah, I've just been really, that's what my passion is now, working with people. So I
Mhm.
really am happy that you invited me on today.
Oh, I'm so happy to have you. And I was telling you before we started recording that you have many fans among my audience already. So many of my audience members already know who you are, the Pain PT on YouTube. And of course, I'll link to your channel in the video description. But it's just such a pleasure to get to speak to you in person and have you share some of your knowledge with those of my audience who aren't familiar with your work.
Yeah, thank you. Yeah, like I said, I'm really excited to be here. I love talking about this stuff. So it's
Yeah.
going to be fun.
Yeah, yeah. So I think everything that you said so far raises a very important question. So you started your career as a physical therapist. You mentioned you're also trained specifically in manual therapy, aka putting your hands on someone to fix them. I know I'm oversimplifying, but nowadays, how are you treating patients? What's different about what you're doing now versus what you were doing then?
Yeah, the irony was, like I mentioned off air, was that I went to Australia in 2002 to do a manual therapy certification program, which they're really well known in the physical therapy world. And as I was there learning all this stuff, that was my opening really to chronic conditions in the body, because we studied physiology of pain and I did a work on some chronic pain. And my
Mhm.
eyes started to open up to learning about psychosocial factors and stresses and things outside the traditional realm. So as I was getting my master's in manual therapy, I was already sprouting something different. And when I came back to the US in 2002, I started using some of this stuff, but like in a traditional clinic, it was very difficult because people come in for a certain type of treatment. And I'm supposed to offer physical therapy, and I would start asking other questions, about their life and what was going on. And as I started hearing more, I was like, oh my gosh, there's something to this. And so then I had reached out to Dr. Sarno when he was alive. Actually, I wrote him an email, and then he said,
Mhm.
hey, go see this guy, Dr. Schechter in Los Angeles. He's another physician who diagnoses TMS. And so I went and saw him, and then that snowballed into this thing over the last 20 years. Really, I've just been learning and learning from different people like Dr. Schubiner and Alan Gordon, and some of even the physios in Australia like Lorimer Mosley and David Butler,
Mhm.
learning about emotions and integrating some psychology stuff. So
Mhm.
it's been like a total shift from super
Right?
mechanical, put your hands on somebody to say, I don't put my hands on anybody anymore. And if they need that, I'll send them to somebody else because I don't do that anymore. And it's been so liberating, to be honest. I really, because even when I did that work, there was a level of frustration because you do something to somebody and they'd be like, yeah, oh, that feels good. That feels better. And then I'd see them next week and say, yep, it's back again. And you do that 10 more times, and then the same thing would reappear. And you go, well, this isn't working. You feel better for 5 minutes or a day, but there's something else happening here. There has to be something else happening because I'm learning all these techniques to telling them they should do this and they don't do it. Well, why isn't it doing that? And
Mhm.
so and then you combine that with what I was learning and you go, oh, yeah, we have a brain. We have a nervous system that's much deeper than just the tissues. And so that's kind of how I started going down into that pathway, you could say.
Yeah. So same here, right? I mean, at some point I felt like I was just kind of coming up against a brick wall every time I would try to help someone. And I don't know if this happened to you, but I've confessed previously on my channel, we would dread having those complex patients show up sometimes.
Yes,
'Cause
absolutely. And PTs still dread that to this day, you know?
right, 'cause there's this sense, and I wanna be clear, and I'm sure you feel the same way. These providers are wonderful, well-meaning people. They are not in a framework where they can actually help people. Like you were saying, you were in a place where you'd start asking these other questions, and there really wasn't space for that in the practice that you were in at the time, right?
Yeah, very little space. I did what I could do. Education, I did a lot of workers' compensation. So in that field, I was trying to educate the physical therapist that, hey, there's a lot of psychosocial stressors or workplace stress that those people leads to more injuries, leads to more pain, and that
Mhm,
these people aren't getting better. Maybe it has nothing to do with their body anymore. It's
mhm,
got to do with some stress, got to do with their mind, do with their emotions, nervous
mhm,
system, brain. But
mhm,
it was very hard. I could not break through. I mean, I had a couple
mhm,
breakthroughs with people, but it was like, not satisfying enough for me.
mhm. And so now you said you're 100% treating people through this, what we've called this mind body approach or a psychosocial approach. So, would you mind sharing more about just kind of in general what that looks like for you in your practice? Maybe starting with who you're treating, who are you seeing nowadays?
Yeah, it's a great question. I'm seeing all sorts of people. So like we talked off air about it's not just one condition or like, oh, this condition or that condition. Like I see an umbrella term, like there's probably hundreds of conditions
Mhm,
that could classify as this mind body syndrome, TMS, psychophysiologic disorder, neural
mhm,
circuit disorder, whatever you want to call it, brain, nervous system, emotional stuff.
mhm,
So once you've ruled out the structural cause, or there isn't one, or there's a very weak association, then I see people with traditional chronic pain anywhere in their body. I see people with fibromyalgia, I see people with migraines, IBS, interstitial cystitis, bladder problems, dizziness, which is one of the
mhm,
things we treat, right? Vertigo,
mhm,
um, all sorts, a lot of facial things, burning mouth syndrome,
mhm.
um, you can pelvic problems,
Yeah.
pelvic conditions, chronic fatigue is a big
Mhm,
one.
mhm.
See a lot of
Yeah.
so anything that could classify under that, TMJ. I mean, like I said, you could go through the whole body and look at different stuff and just say, "Yep, that's what this is." So
Mhm,
for those listening, just understand that your condition, your diagnosis is just words, guys. And if there's not a real structural pathological thing, you've got a huge brain up here and a nervous system that controls the whole body and can cause all sorts of stuff. And I see it every day, crazy stuff in the body that you couldn't believe the brain produces. But
mhm,
there's nothing wrong in the body. So it's very
mhm.
powerful.
Yes. Yes. So, in other words, when someone has a medically unexplained chronic condition, and in other words, they've again here in the United States, frequently people will have been poked and prodded and imaged in every possible way. Some in other countries, sometimes there's maybe a little less testing done, but you say, okay, at that point, we pause and we say, well, it's not that we haven't found the biological cause, it's that we need to start looking at these psychosocial causes of disease,
Yeah.
right?
I always tell my patients, and I would get amped up on this stuff sometimes, that this is the biggest thing missed in modern medicine. And it's incredible to me when I really step back and think about it, right? Because
It
I think
is.
we have so much technology, so much imaging, so much amazing stuff. And yet this is right in our faces and we've missed it. It's incredible. And the doctors aren't asking questions. So really, my practice, like you said, well, how does it work? Well, the first step is getting a history and a broad history, not just, oh, what's your symptom? And okay, what
Right.
happened to you? And
Right.
like in a
You're
microscope, like zoom out and go, okay, all right, you got this. Let's look first at your physical stuff. Yes. What testing have you done? Have you seen the doctor? Okay, how long have you had it? Because the longer you've had something, the more chronic it becomes. We know from the research that there's a good chance that your brain and nervous system is involved now. It's not just your tissues. The body heals,
Mhm.
structures heal.
Mhm.
And then you start asking, okay, simplest question you can ask somebody. What was going on in your life around the time your symptoms started? Either a little bit before, back a little bit. And just, was there life changes? Was there stress, under pressure, something out of the ordinary? And almost always there is something that you can say, that's not normal. You were going along and all something was going on, right? And the doctors don't, that simple question alone could save so much agony. But I've seen one lady, I'm just thinking again, who had a surgery on her sciatic nerve. She flew from the UK to the US to get it done. It was not successful. And the simple question could have been that: was there anything else happening? Because there was no clear injury. Started
Mhm.
at work,
Mhm.
sitting in a chair.
Oh,
Okay, but
yeah.
look at this. So the simple question could have said, "Yep." You know what the answer was? My father passed away suddenly, unexpectedly from a heart attack. One night I talked to him. The next day he was gone.
Mm.
My pain started a month after that,
Mhm.
from no physical cause.
Mhm.
Now,
Yeah.
again, that's pretty clear to me that there's an emotional injury, you could say. So I would call these emotional injuries sometimes, or stress injuries, not physical injuries. And you get stories like this all the time. Maybe it's an uptick in stress. I've seen people retire, which they were looking forward to, and they
Oh,
couldn't
I've
believe
seen this too. This is
it.
a thing. Yeah.
Yeah,
Yes.
positive, seemingly positive things. Getting married can cause physical symptoms in your body. Um, so anything that upticks the stress, even excitement, too much excitement in your system can cause you to have symptoms. I mean, we hear about people watching football games and guys getting overexcited, they have a heart attack.
Yeah.
So your emotions, which you could call stress and emotion, you can interchange those words because stress means emotions, from your limbic brain, can create these physical symptoms in your body. And in some people, a lot of times people have these all the time, but they just go away and they don't think about them. But for some people, they stay stuck or they stay turned on. And those are the ones that end up becoming chronic.
I was just going to ask that question. So, what you're saying, and I fully agree, everyone has some kind of mind body something sometimes. I get nervous before a test, I get, a little bit of stomach pain, or maybe I have a really stressful period of time and I get a migraine. But for only a small subset of people, these symptoms become chronic. So, what, in your view, is the reason for why some people have the symptoms become chronic?
Yeah, that's a loaded question. That's a great question. It is the
We
million
can
dollar
tackle it
question.
together. Yeah.
Yeah. I mean, because right, most people, just like injuries heal,
Mhm.
there's about 20, maybe 30% of most of the people who don't, and they end up getting chronic. And
Mhm.
I think there's maybe a couple of reasons we could put our finger on.
Mhm.
One, we know if the person is having a lot of stress again, so they're either anxious, they have a history of anxiety, or maybe depression.
Mhm.
Those people are more likely to develop chronic symptoms. So even we have research showing, with, let's say, for example, back pain.
Mhm.
Um, at the time of the acute back pain, when they were doing brain scans, they
Mhm.
could tell that the emotional brain was overactive. And those were the people they could predict with about almost 90% accuracy rate that they would become chronic. So we have evidence to show who are these people that don't get better. And it has to do with your emotional brain. So you can say anxiety, depression, history of adverse childhood events, traumas, PTSD, highly sensitive people too, typically have trouble. They really feel emotions strongly. They react a lot. So stress, and it could be current stress, old stress. Those ACEs, adverse childhood events, really, really associate strongly in midlife with symptoms. And that's years ago, right? So we forget about that stuff, but it can really impact the brain and nervous system. So I think that's what I would say why that happens. Or the person really is, you can say worry ward or catastrophizer. They get a symptom and then they blow it up. That's a reaction, the secondary reaction we call it. So they worry about the stuff. That's anxiety. Anxiety causes so many symptoms in the body. That's probably the number one cause, I would say, is anxiety for a lot of people.
So do you think, and this is another loaded question, but we're going to just go for it. So do you think anxiety just is something people they're just born with, and, oh, you're anxious, so you're just, that's just kind of the overarching reason and there's no reason for your anxiety? Or do you feel like anxiety is another symptom of what you were talking about, emotional stress?
Yeah. Yeah, it is emotional stress. And is it passed down? I think, yeah, there could be some argument for that, but it definitely learned from environmentally what happened to you. And typically in childhood, when you're growing up and you're not maybe getting support, attention, love, your needs aren't being met, or you grow up in a volatile environment where you're walking in eggshells, or you're having to be aware of how your mom or dad are and you're not sure what's going to go on, that can be a breeding ground for anxiety. And people can then carry that forward, maybe at a subclinical level. They don't even really know.
I was going to
That's trouble
ask.
for me.
So it's not always like, oh, I'm a super neurotic, anxious person. Anxiety doesn't always show up on the surface, right?
It doesn't always show up on the surface. And I look back at my life and I go, wow, I always had anxiety. And I just didn't see it until I was into my later midlife. And I had just coped with it, I guess, in some way. But I look back and go, my goodness, I was anxious around a lot of things, worried about things, nervous, not feeling like confident, you can say, secure. So, and then what can happen is it can ramp up for some people. So something happens now, again, they have some event. Health anxiety is a big one, right? So I've had a lot of health issues. They start getting anxious about that, or life event. I've had people who had one panic attack, and now what that does is raise the bar in the nervous system to become more sensitive. And now they're prone to being more anxious, like open the floodgate a little bit. So there's different reasons for it. And we could probably talk for a long time about it, but there's also emotional connections between other emotions with anxiety. So anxiety by itself can be, you can be afraid of something and scared, worried, and that could be it. But there's a lot of people who, when we talk about other emotions like anger, for example, one of the questions I always ask people, and almost everybody says yes, TMS personality, is, are you conflict avoidant? Do you by nature like to avoid conflict? Now that's a loaded question because we take the two words in there, conflict avoidant. Avoiding, it means fear avoidance. I don't want to do that. I'm going to pull back. What is conflict? Anger. So we would look at avoiding anger. TMS people, again, by their nature, are the nicest people. I tell this about you. I said, I love working with you guys. You're so nice.
I know.
You're not mean.
I've said jerks don't get dizzy. I say that all the time.
You're not a narcissist. You're just a great person. And you're too nice, basically, right? You're too nice. And again, back to childhood, we develop these patterns where you can imagine, and if we all think about it, you're a child, you have no position of power, really. You're seeking love, attention, support, you're nurturing, you're growing, you need somebody to help you. And most people will do everything in their power as a kid to get that. So getting angry is not going to help you most of the time because you'll get overpowered. Go to your room. oh, you're not behaving. I'm going to take your phone away. I'm going to do this. I'm going to do that. So we learn that it doesn't help us.
I've had people
Or,
say that. I
yeah,
learned not to get angry because it didn't do anything.
it did. And it didn't. And so it was a
Yeah.
good technique or strategy or coping mechanism at the time.
Mhm.
Or another example would be a parent was overly angry, explosive,
Mm.
and
Mhm.
the child was very scared. And that could be how I grew up. My dad was really critical at times, and I think it made me very anxious. My parents argued all the time. That made me very anxious because I didn't
Mhm.
like that. I was scared. As a
Mhm.
child, I thought something was wrong. So that was a breeding ground for anxiety in me. But what you have to realize is under anxiety can be anger. And so sometimes what you don't people don't realize is they're actually angry, but they only feel anxious.
Mhm. Yeah.
And that's a whole nother subject, but it's very interesting when you dive into the anger anxiety relationship.
Yes. So again, these are things that we talk about on my channel a lot as well. So just to circle back around for people listening, taking this approach, helping people uncover some of these things, uncover some of these emotions, seeing the connection that anxiety has with the fact that their symptoms have become chronic, you see people get better.
Yeah, they do. When you can make these connections, there's lots of ways people talk about how you express or release emotions, right? And there's the classical journaling
Mhm.
that's been put out there. There's emotional awareness and expression techniques that I work
Mhm.
with people on
Mhm.
through imagination, through expression, through verbalization,
Mhm.
through connecting somatically. I love working in the body too, because if you think about emotions,
They're in the body,
yeah, they're
feelings.
feelings. And
Yeah.
then we're disconnected from that too. We can say that, yeah, they're feelings, but then we go, that pain you have there, or that dizziness you have here, do you know that's a feeling? And if that is not a structural symptom, it's an emotional symptom. That's a feeling. And people say, oh, I don't feel my anger. I don't feel angry. Well, what about that raging migraine?
Mhm.
So it's like very clear as day, but people don't make the connection
Mhm.
all time and time again. So my job is help people make these emotional connections to their symptoms and to what's been going on. It's really, really important to try to realize that your feelings are symptoms, and your symptoms could be structural or they could be emotional, and they feel the same way. So
Mhm. Mhm. Because everything, all experiences are coming from the brain anyway, whether there is a physical stimulus, so something happening physically or not, it's the brain whose opinion gives you the experience or whatever it is. So through
yeah,
the lens of your brain, whether it's emotional or not, it's the same exact pain, it's the same exact dizziness.
yeah,
And there's a taboo, I think, in our culture that it's either real or it's not. And the only real thing is structural stuff. And this
yeah.
other stuff isn't real. It's in your head. You need to see a psychologist. There's a big stigma about that, wouldn't you
Big
say?
stigma. Yeah, it's terrible. It's terrible. And that also breeds into why we miss this. And it's sad, but like, what would you say about the amputee who has phantom limb pain? Would
Mhm.
anybody argue that that's not real?
Mhm.
And could anybody argue that it has to be coming from your brain? There's
Mhm.
nothing there anymore. The foot's gone.
Right.
And so
Right.
that's one of your most classic examples of the brain producing very real pain. And it is in your head, but it's not in the way you think. There's nothing wrong with you mentally. You're not a lunatic. You're not mentally wrong. You just is how your brain works, and your nervous system's wired up to your brain, which
Mhm.
goes anywhere. All organs, all tissues in your body are innervated by the nervous system, which connects to this master computer here, which has
Mhm.
stored your whole life in it.
Mhm.
It's instantly making calculations all the time, and a lot of time erroneously, right? A lot of times it's overshooting, it's overreacting,
Mhm.
danger, thinking danger, perception of danger, and then you get a symptom.
Mhm.
So yeah, there could be lots of reasons. It's very fascinating. The more you
Yeah,
learn about it.
it is, but I think what you're saying too is it's important to normalize this. You're not seeing people with necessarily mental health issues at all. This can happen to perfectly normal, healthy, well-adjusted individuals.
Yeah,
In fact, sometimes it's the healthiest, most well-adjusted individuals that end up with these problems because that's how they manifest rather than in a mental health issue.
100%. I love that. I have a guy I work with now who he says, I went to my doctor, I got my blood work done. The doctor's like, your blood work is amazing. You're like the blood work of a
The picture of
30-year-old.
health.
And he's a 50-year-old. And he's like, why do I have this? He has a PPPD, he has dizziness, he has IBS, he has all these moving symptoms. He goes, why the heck do I have this? But why? Because he has a real big history of anxiety, right? He has a lot of sensitivity in the system.
Mm-hmm.
And so that's why. But his health is fine. He's
Mm-hmm.
perfectly normally fine. They can't find anything wrong with him.
Mm-hmm.
So he's a picture of
Mm-hmm.
health, even though he has all these symptoms.
Right. Oh, yes. So, do you also see people? I know the answer is yes, but I'd love to hear your thoughts. Do you also see people who show up not just the picture of health, but without any anxiety? Like they show up and I'm like, I was cool as a cucumber until all this happened, and now here I am. So you see that too, right?
See that too.
Mm-hmm.
Yeah, you see all different variations. So not everybody comes in with anxiety. Some people are real, the calmest people. You look at them and you go, oh, this is like Mother Teresa. Like they're so
Yes,
calm
I
and
know. I know.
how could they have any problems?
Mm-hmm.
Right. But you don't know what's going on underneath the hood of their demeanor.
Mm-hmm.
And sometimes people that are so calm, so kind, can't say a mean word. There's a lot of repressed anger in those people. I had
Yes.
one lady who said, I've never said a curse word my whole life. I go, oh, you must really have repressed your anger.
Yeah.
Because we know now that even cursing and swearing is therapeutic.
Mm-hmm.
Those of you listening don't like to do
Do you
that
hear that, everyone?
because of religious reasons or because of your
Sure.
upbringing, that when appropriate, it's a release valve for anger. And there's a reason why people, let's say, God, oh, they say it so fast, it just comes out reflexively. It's a release of anger,
Mm-hmm.
and it just helps them blow off a little steam.
Mm-hmm.
Okay, but when we're so repressed that we're just like a stone, nothing's being expressed.
Mm-hmm.
So it's like it goes in the body. So there's those people too that aren't really anxious. They're just they seem to be calm. They seem to be like, why would they be having this? They're very stoic people. They also are prone to these conditions
Mm-hmm.
just as much as the anxious person who's got energy all over the place and they're all over
Yeah.
like this are also prone. Depressed people, also people who sadness. So all the
Mm-hmm.
emotions can create physical symptoms. We have great research on that. Anxiety, depression. Depression is basically what? Sadness, anger. So all the emotions could potentially cause symptoms in your body because they're feelings.
Mm-hmm.
Um,
Okay.
yeah, it just
Yeah.
depends.
Yeah. So again, lining up a lot with the content people have heard on my channel, and I'm so happy that your experience has been parallel because I think this hearing it from more than one person can be really helpful. So kind of along that line, um, you mentioned before we started talking and recording, you mentioned that you have worked with people with these various dizziness diagnoses. So triple PD being one, where you have the chronic dizziness symptoms, the unexplained chronic dizziness, MDDS being another, where people have this rocking, bobbing, swaying 24/7.
Yeah.
And I'd love to hear a little bit more about your experience working with them and what, if anything, you do different with them and how they do in the long run, because I
Yeah.
think people would love to hear that.
Yeah. So the way I see it, just like all those other conditions I mentioned that I treat, is once we know there's nothing there, like we could really put our finger on,
Mhm.
and you just want to lump it into this category. Okay, rather than like there's probably like how many diagnoses do you think you could see just in your world of dizziness,
Oh,
right?
yeah.
That can be lumped in.
Yeah.
So I want people to know the diagnosis is just words. And once we ruled it out, that's not what you have anymore. Okay, so you want to drop that. I had
Mhm.
I had a guy yesterday, and he had a bout of what he called BBPV come
Mhm.
up,
Mhm.
which is what he thought.
Mhm.
And we talked through it, and I said, you know what? You have a history of anxiety, and you were having, and this is an interesting story. He was having other symptoms. He traveled out of the country
Mhm.
So he was off his normal place. He was anxious about the trip to begin with.
Mhm.
He was coping pretty well there. He said he was using some coping skills for his anxiety, and his anxiety was going down. And all of a sudden, he had noticed before he got some dizziness, he got some tingling in his hands.
Mm. Mhm.
And then all of a sudden, he noticed he was getting some dizziness. He was turning his head, and things were moving and swaying. And he was feeling all this up in here, and his neck was getting tight and
Mhm.
sore. And he came home, and he's still been experiencing that. And he said, "Oh, I think maybe something's wrong with my inner ear, or I got cervicogenic dizziness, or
Oh,
I got
yeah.
something
That's
else,
another
right?"
one. Mhm.
And I said, "Wait a second. Let's back up the bus. Let's look at the picture again. What did you do? Anything physically? Were you sleeping on the same side all the time? Were crystals moving out of your ear? Probably not. Did you get jerked around? Did you tweak your neck? No. Right? So he said, were you feeling a little anxious? You're out of your element. Yeah, I was. And then I said, do you know that people with BPPV, if you have anxiety, you have 2.1 times the risk of developing BPPV from anxiety. So you double the risk. So anxiety can cause that.
Mhm.
So my diagnosis for him was this is a version of anxiety in his body. And one of the ways I see it is if you think about anxiety as energy in your body, as fear, how does that feel? It's a shakiness. It's
Mhm.
shaking. It's vibratory,
Mhm.
nervy, pulsy, tingling,
Mhm.
numbness, dizziness.
Mhm.
So a lot of people I see with dizziness, I see a lot of anxiety.
Mhm.
So that's a connection I can make with a lot of people because how your symptoms feel also indicate the emotion. And this, I
Mhm.
don't know if a lot of people make this connection, but I try to do with everybody is go, what are you feeling? Give me some words, how you describe your feelings. And then we want to link them to emotions if they're not structural
Mhm.
causes.
Mhm.
So, yeah, so I see a lot of this stuff as a level of anxiety.
Mhm.
A lot of people. Sometimes, again, there's other emotions underneath that anxiety that we need to look at.
Mhm.
But I think for me, that's how anxiety represents for a lot of people.
Mhm. It's not necessarily the classic anxiety where I'm really stressed out all the time and I'm like all, walking around like worried and scared. It's not going to necessarily manifest that way for a lot of people. You're saying it manifests through symptoms instead.
Yeah, so some people,
Mhm.
exactly right. The classical anxiety is I feel in my stomach, anxiousness, I feel in my chest.
Mhm.
But anxiety can go anywhere in your body through any neural pathway. If any of you guys want to look up a great site, called the anxietycenter.com.
Mhm. Yeah.
There's like 100 symptoms on there that you can have that are anxiety symptoms in your body, maybe more, just all over the place. So it can cause a whole bunch of stuff. Why? Because it's a sympathetic nervous system discharge that, remember, your nervous system is wired up to every organ, every tissue in your body. So it can come out anywhere. And
Mhm.
it's quite incredible, guys. I've seen it move around people's bodies, as Dr. Sarno will call the symptom imperative.
Mhm.
I have a lady who, I'll give you another example of anxiety. Post-COVID, breathlessness, long haul COVID, which
Oh,
we call
yeah. Yep.
TMS mostly. And she couldn't walk, she couldn't do anything because I'm short of breath. She's checking her oxygen level. And I said, this is anxiety. I said, you don't have long haul COVID based on your history and what you've been through. So she actually started getting over it. We worked together. She's getting better. She's walking. And now all of a sudden, she's noticing weakness in her legs, like her knees, and she can't lift her right foot.
Mhm.
Incredible. I mean, there's nothing wrong with her legs,
Mhm.
but that's the anxiety shifting into another location. And if you think about fear, which is anxiety, think about weak in the knees. I'm weak. That's fear,
Mhm.
or sometimes stiff. I'm scared stiff. So
Mhm.
you can kind of we use words to describe our emotions, but this anxiety can move around because it's a danger signal trying to tell you something's wrong, but it's perceived danger.
Right. And I know I keep harping on this, but I want to be clear because I see so many people in my channel who object so much to me using the word anxiety. So when you're referring to anxiety, you and I are talking about anxiety, the physical tension, physical anxiety, like
Physical.
something's wrong, danger mode, aka danger mode. It doesn't mean you're an anxious or neurotic person or that you have it on the outside. And again, I know I've said that a bunch of times, but I want to be clear since I know so many people show up on my channel. They're like, I'm not anxious. I'm just not anxious. You can't tell me that this is anxiety. It's not. And we're not saying you are anxious. We're saying
No.
this is physical manifestation of danger mode in your body.
Yeah. And the other thing, guys, you got to understand is when someone says that, yeah, you don't feel anxious. Why? Because you
Right.
feel it physically.
Right.
You
Right.
don't make that connection. And
Right.
I didn't do that for years. And the same thing with anger. It's incredible. Oh, I got this raging migraine, and you hear the story and you go, sounds like you should be angry. And they go, I don't feel angry. Well, not classically, but it went through another neural pathway and
Right.
showed up through a symptom. And
Right.
so that's why maybe you don't feel anxious, guys, but it's nothing wrong. It's not a bad diagnosis. Everybody has anxiety
Mm-hmm.
some level,
Yes.
and it's just fear.
Mm-hmm.
Does anybody in the world not have fear?
Right.
So anxiety is another word for fear. No, it's
Mm-hmm.
impossible. You're a human being. We all have fear.
Mm-hmm.
So yeah, that's kind of like break that down, right? It's not
That
bad.
I love that you did. I love that you did.
Yeah.
And I know that we're running short on time here. So I want to make sure I ask this because I'm sure everyone wants to know. Do you see people get better? Do people with chronic dizziness recover?
Yes. They do recover. And if you use the principles that you're teaching, I'm teaching, it's all the same stuff. We're really needing to just learn to tap into a different system, a different way of understanding, different
Mhm.
way of working with ourselves, reducing the danger signal, the perceived danger, creating safety, working with our emotions, looking at maybe what were some of the causes. And then also, I think another thing we can touch on is your personality and maybe how you act and behave can create these things in yourself. So self-imposed pressures, people pleasing,
Mhm.
perfectionism,
Mhm.
all these things that overdoing, overachieving, overtrying, overextending, all these things can cause your symptoms um, to come back or to keep going.
Mhm.
Okay, so there's lots of facets, but if you can focus on your brain and nervous system and just get away from the structure, I mean,
That's the first and most important step. It's the most important. You're 90% of the way there if you can get to that point, right?
yeah, you just have to move past it. Hey, if I can move past it, I've been a physical therapist for 20 years. You can
Yes.
move past it. And same
Yes.
thing for you, right? If
Yes.
you've transitioned, there's a reason why we transitioned to this work, right?
Right. 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 Exactly. Exactly. So people really do get better, but the take home message is A, you got to believe that there's nothing wrong with you because there isn't. This is normal. It's normal. It's a normal adaptation.
Yeah,
And
it's totally normal.
it's normal.
Normalize it. That's one of the words I like to use. Normalize.
Mhm.
Um, Everybody listening, are emotions normal? Yes. Is there
Mhm.
any human on the planet who doesn't have emotions?
Mhm.
No.
Mhm.
Biological. It's
Mhm.
the limbic brain that causes this stuff when it's not your body.
Mhm.
And it's just emotional energy in your body coming out in a physical way. That's the
Mhm.
simplest way I can tell people, and it's normal.
Mhm.
And if you look at the person's life and story, you go, yeah, that makes sense why you're sad. Hey, I understand why you're angry, but you just haven't acknowledged it. Okay. Yeah, you went through this terrible life of these things. Yeah, I can see why you're anxious. It's just that's why how it's coming out in your body. It's fine. It's okay. Don't blow it up.
Right. Right.
You
And
know?
then
Yeah.
from there, moving that energy. So like working with the body to help those again, I don't like using the word, get emotions unstuck, but essentially allowing the emotions to take their natural course, rising and then falling in the way emotions do when they're allowed to be, right? And I know on your YouTube channel you have several follow along practices that people can try to
Yeah.
do some of this. So they're somatic tracking type exercises and I highly recommend them. So if you're watching this and you're like, what the heck does he mean by working with the body? Jim has this on his channel. Go look at his channel. There are some practices there you can check out.
Yeah. Yeah. I love the somatic work because that's where these emotions, feelings, you call them symptoms live. They're in your
Mhm.
body. So when you can connect with your body in an open way, like you said it beautifully, the emotions need to flow,
Mhm.
emotion, energy, emotion. They want to move through you and they'll go out.
Mhm.
But we have such resistance to them or reaction to them because they don't feel good,
Mhm.
and we have some kind of connotation that they're bad. But like I said before, are emotions normal? Yes.
Mhm.
Okay, so this is where you want to normalize your feelings, and there's nothing wrong with you, guys. Once the structure is ruled out, it should be like, ah, thank
Right.
God.
It's a good thing. It's great
It's
news.
great
Yes.
news.
It's
There's
great news.
nothing wrong with you. In fact, your system, I always tell people, look, no severed nerves, no torn muscles. The only thing that's not going is what's flowing through the nervous system. That's the only thing. It's like what's flowing through you is like maybe some garbage or sewage. It has to flush out of your system.
Mhm.
So just let it go. It's not dangerous. It's still water. It's not poison.
Mhm.
Emotions are water.
Mhm.
Everybody has them. They're just been bottled up in the system, or they're coming out in the physical way and we don't understand it. But you're fine. So the less you worry about it, very simple, like you said, you're 90% there.
Mhm.
That's why some people can get better quite quickly from this.
Mhm. They watch a video or 2 and they comment and they say, "I'm cured, it's gone, it's so much better," or they get a temporary relief just from one video, and that's the
Yeah,
perfect
temporary.
indication.
And
Yeah,
I do want to say that that's not the norm, I would say.
sure.
Not, at least the people I work with, we work for a period of time.
Mhm.
Usually can take some time because we're undoing a lot of patterns and
Yes.
personality traits and ways of behaving and dealing with stuff.
Agreed. Agreed. And I know we could probably talk for another 2 hours about this. Again, I'm just trying to be respectful of your time. So, if people wanna learn more, about your approach and what you're doing, so I know you've got your YouTube channel. Where else can they go?
Yeah, you can go to my website,
Mhm.
thepainpt.com.
Mhm.
And on there, there's a lot of information I put out there. You can, if you need a want consultation one-on-one, I do that. I also started a group practice. I just started for
Mhm.
somatic. So it's really focusing on the somatic. We just talked about getting in your body and feeling. We're going through
Wonderful.
that every week to try to build more and more of that ability to stay in your body and feel your feelings and be okay with them, essentially.
Mhm. That's awesome. I just started one as well. I know we had mentioned this when we were corresponding,
It's
and
awesome.
it's there's so much need. So I'm so glad that that's something you're doing too, and that that's your focus of the group, because that's really helpful to people.
Yeah, thank
Wonderful.
you. Thank you. Yeah, and likewise.
Yes. Yes. Well, thank you so much for coming on. Like I said, I really could think of at least a thousand more questions to ask you. So I will have to talk again. But I think this was super helpful. And guys, you can recover. You're hearing it from me. You're hearing it from Jim. You're hearing it from many of the other people that I brought on as guests on my channel. So just we're not all we're not just lone wolves out here on this channel. There are others doing the same work who are seeing people recovering too. So
Absolutely, yeah. Yeah,
mhm.
you can absolutely, again, there's nothing wrong with you in the first place. It's just that you need to get your system settled down and you to just understand that these are just emotions and stresses and your sense of sensation in your nervous system. And when you calm down, everything settles down, things just start to fade away.
That's
So,
it. All right. Thank you so much, Jim. I hope you have a great day. And thank you again so much for your time today.
okay,
Appreciate it.
thank you so much for having me on.
Of
Appreciate it.
course. All right. Bye.
Bye-bye.
Bye.